Well, good afternoon, everyone, and welcome to what we hope will be a very engaging conversation about the current status of the COVID-19 pandemic in Indian country, particularly to the north in the state of Alaska with our brothers and sisters and cousins and relatives, our Alaskan Native population in Alaska. I'm David Knoyer, and I am looking forward to this trip up north. I'm based in the state of Minnesota, and haven't been to Alaska in a few weeks, months. Lost count, right, once you hit a certain age. Enrolled here, David Knoyer, the Rosebud Sioux tribe, and I'm very, very excited about the speakers that we're going to have today to talk about COVID-19. The headlines coming from Alaska are pretty serious, and we want to get tabs on the latest state. And we have several guests joining us, two experts from South Central Foundation. And I wanted to bring into the conversation immediately Donna Galbraith and her colleague Dan Hartman, both working for South Central Foundation, serving probably the largest group of Alaska Natives in the state, I'm guessing. And when you look on your website, Donna and Dan, you look at a very complicated service area that you serve. So when I ask about the state of the COVID-19 pandemic there, I know it's not a simple yes or no answer. Before I switch it over to you, I just want to remind everyone this is a part of the We Can Do This campaign out of the Department of Health and Human Services. And we're really here to try to get a conversation going. We all know people who are on the fence about the COVID-19 vaccines, people in our own families, people who've become infected without the vaccine, folks who've contracted the virus even if they've been vaccinated. So we know this isn't a simple topic, but we want to have a conversation and arm all of us, right, with some of the best information so that we can have a productive conversation with folks that we care about and that we want to be healthy. So Donna and Dan, let me turn it over to you and introduce yourselves. Thank you.
Hi, I'm Donna Galbraith. I'm the Senior Medical Director of Quality Assurance at South Central Foundation. I'm Atna Athabaskan from the village of Mentasta Lake. It's a small community in the interior of the state. I'm a family practice doctor, and I worked at South Central for about 15 years. And prior to that, I worked for another tribal organization within the state.
Thank you for joining us.
Hi, I'm Dan Hartman. I'm also a medical director, work under Donna here at SCF. I have been, I think it's 2002 that I started working in the Alaska Native Health System, initially in Bethel for a decade or so, which is in the far west, and now here in Anchorage. And I have a background in public health, and that's one of the reasons that I'm on this show.
That's awesome. Thank you both for your service and your commitment and for taking time to join us today. You know, looking at the headlines from Alaska and a lot of places where the vaccination rate isn't as high as it could be, right? The last I saw, the overall vaccination rate from the Centers for Disease Control data for the state of Alaska is somewhere in the high 50s. It just depends, I suppose, if you've had 2 doses or 1 dose. But what is the current state of the pandemic there?
Well, you started off with the vaccination rate. Yes, it is in the 50s, and it varies per region. So you have, small communities that can be up to 90% vaccinated, and then you have other areas that can be in the 30s. So it ranges quite a bit, and the average comes out to the 50s. And now we're having this increase in cases in the state. It's quite alarming because every day we watch the numbers. We're just waiting for the numbers to come out on, the past 24 hours, and then reviewing the weekly numbers when those numbers also come out to see where we're at and what's happening. It's definitely having an impact on our healthcare setting. All the hospitals, including Alaska Native Medical Center, are very, very full and very busy. So, if you just talk about Anchorage here, that's where we're located. The hospitals here in the city, you have Providence, Alaska Regional, and Alaska Native Medical Center, or ANMC. Those hospitals sometimes are the emergency rooms are so busy, they're actually closed, and it's actually more frequent than not that all 3 of the emergency rooms are closed. And they're actually called in recovery when they're closed. They use funny terminology. But what happens when that occurs is the ambulances alternate which emergency room they're going to, so that one emergency room isn't overwhelmed. There's lots of people being admitted to the hospital. The increase in COVID cases has increased admits, which has an impact on all admits. So, say somebody needs to be admitted for another reason, not COVID related, they're still scrambling to find a bed for that person. So beds are an issue. Staffing is an issue. Staffing are overworked. They're tired, but they continue to do the work that they do. We here at ANMC have had some Indian Health Service worker or travelers come in recently. For instance, we got 2 pharmacists just the other day, and then we've got a few nurses, but we definitely need more, and all the hospitals need more. The state of Alaska actually is having a bunch of healthcare workers come in and work, and they're going to divide them up amongst all the different hospitals. I would like to also just say that one of the things that has occurred because of this is because we're the state is huge, but in terms of population, we're kind of small, and because of this crisis, we are working together with all the hospitals, and we are working together with the state on what's occurring here and how can we support one another. So the collaboration has been really good in this very trying time.
Yeah, tremendous cooperation within the health system and between the health systems in the state and the tribes and the state of Alaska. So good news there.
Yeah, as you said, it helps that pretty much everybody knows everybody on some level, and if they don't, they know somebody who does, right? And you would think in that kind of situation that Alaska would have kind of, forgive my colloquialism here, but had its act together, right? It certainly could have, because when we saw when the vaccine rolled out, right, there was a lot of positive news with the corporations, with foundations such as yourself, getting that vaccine out. In fact, I remember one sort of controversial story, right, that suggested that, hey, why aren't the Alaska Natives helping the public school teachers and helping the dominant society folks because of how good it was going at the beginning, right? So what's happened?
Well, you were right. There was a lot of communication about that, and actually, we did help many groups.
We helped a lot.
Yeah, we opened up our vaccination clinic to everybody, and we didn't care whether they're Alaskan Native or American Indian. We opened the doors. I mean, we started off, of course, with our most vulnerable, so those actually 50 and above, we vaccinated first, and then we just opened our doors to anybody that wanted to get their vaccine. So we were working together with the state. We viewed it as, all of us are exposed to one another. And so the more people that are vaccinated, the better. And at first, it went really well. In fact, we were making headlines as being like one of the highest vaccination rates in the US, but then it just kind of petered out. And now, we got the early adopters, and now we're trying to convince everybody else that they should get vaccinated, and the reasons to do that. It is very crucial that everybody get vaccinated to help, protect all of us.
And as you said, Donna, the vaccination rates do vary across the state. And I believe in the list I saw the other day, among the higher rates are up north in some of the more rural areas, right? Out towards Bethel. And then I don't know exactly what the other hub would have been, but they were definitely not Anchorage. They were definitely not the Kenai Peninsula, right? So a lot of the Alaska Native populations, at least in the bush, so to speak, they've taken this very seriously.
Yeah, there's many areas that have done really well. I think Bethel is in the 91 percentile of being vaccinated. It's really amazing. It's phenomenal. The Eastern Aleutian tribes out on the Aleutian Islands, they're in like 88%. They're really good. So some communities have taken this quite seriously, but there's still hesitancy amongst other areas.
Well, speaking of positive vaccination rates in the Bethel area, let's bring in tribal chief of the Akiak Native community there. If Chief Williams can hear us, Mike Williams Sr., if you're with us, welcome. Thanks for taking some time to join us. And how about a quick introduction of yourself, if there's such a thing, Chief?
Well, I'm the tribal chief of the Achac Native Community, and last fall, in November, we had 61% COVID testing. When we did the testing in November, and it was 61%, and it was very scary time last year in November, and of course, we had complete lockdown, and we put in a lot of strict rules, and not allowing anybody traveling in and out of the community. And but I think with the herd immunity that we've experienced, it was we seen 2 deaths in the community, and when we had funerals, we just had them straight to the graveyard, and it was a sad time. But we, after the vaccinations and after all of the cases went down, we ended up having some memorials this past summer, and we kept the social distancing, the masks, and we still do, and we're just very afraid of the second little wave we had in recent times with the current virus, and it really makes us very nervous, and but we just really appreciate the sacrifices that our community members made in terms of adhering to the strict rules. But hopefully, we've been working hard to get everyone vaccinated. But, we had between 50 and 60% vaccinated now. And, we just, for some reason, that 40% refuse to get vaccinated, and it's just a challenging thing when people have their mindset that they are not going to get vaccinated, and it gets real challenging. But we continue to advocate for people getting vaccinated, and we had 2 shots, and then we had Moderna with 1 shot, and then waiting for the booster out here. But I think with lack of running water, overcrowding in the houses, and really challenging area in Western Alaska, when a lot of people don't have running water and safe water to drink. It makes things a lot more, and need for more housing to deal with the issue of overcrowding, and and also the lack of infrastructure in the communities, with lack of high-speed internet information systems that we lack in our communities, and I think we're working hard to make sure our community in Nakiak are, we have working hard with ANTHC and with the with the with others to make sure there's running water and potable water to keep everybody at least safe with our uh, water and sewer systems for each home. And it's just
Oh, we lost him there. Um, Donna and Dan, you heard him talk about herd immunity, and I don't know if that's technically what's been going on there in his village, which I know is not too far from Bethel. If Bethel had a 90% vaccination rate, that would qualify as herd immunity. And if now people are traveling in and out of the community, uh, I'm is it fairly standard though right now for everyone to be masking up all the time out in those parts too? What are you hearing and seeing?
Go ahead.
Well, the masking works. There's, Mike's back if you want to.
Oh,
yeah.
go ahead.
Sorry, that's
Yeah.
lack of broadband high speed internet. We're going to have broadband high speed internet by November in Nakiak, and we're working hard to do that. Masking. We continue to do the masking and social distancing, and we just for a while it was lax for a while when all the cases were down and disappeared, but the cases have gone back up, and we're instituting these mask mandates. We continue to do that, and social distancing and hand washing and hand sanitizing, and make sure that public places are sanitized as well. So we're working with the school district and with the clinics, and we appreciate the testing regime that YKC provides, and but that needs to be ongoing, and we're doing our part, and hopefully that will increase housing to eradicate the overcrowding, and also fixing old houses, and making sure that they have running water. So masking is something that we do faithfully, and I just really appreciate this time. I'm bringing my family home right now, getting ready, and I'm in Bethel en route from a little break from all the work all summer long, and we haven't had any breaks, and but we continue to work hard to prevent COVID from happening in our community, and we'll continue to work hard, and we appreciate the support from the health organizations and from the federal government that provide us with CARES Act and ARP monies to do these things to prevent COVID. So we really appreciate it. Thank you very much for the time.
Chief Williams, thanks for joining us, and I'm glad you had some time off, and appreciate your time and making an effort to see your face, and stay healthy and well. Take care.
I am very healthy right now, and just got back from Hawaii. So
well, aloha.
Thank you.
Donna and Dan, that brings up an interesting, chances are the chief was over there for work, but we have this tension between political and business leaders writ large, not just Chief Williams, but in the papers, right, between trying to keep the economy going, air travel, cruise ships, hotels, etc. And yet we know this need to social distance and to even stay home in some cases. And that tension is challenging, right? And I know Alaska relies on tourism. What are your leaders? How does this factor into your equation there as healthcare providers?
Well, it is a difficult tension, to put it mildly, because there's a real need to keep people employed, to keep places open, and just to keep the economy going, because that has so many impacts that can be very, very negative and detrimental for an individual. So that's very difficult. But in the healthcare setting and in other settings, people should be wearing a mask and they should be physically distancing. I know that, when I go to stores, I am always in a mask, and I am unfortunately a minority in those areas. Restaurants seem to be a little bit better about wearing masks, but when somebody sits down, they don't have to wear a mask. But most of the restaurants are okay. They, their tables are spaced out and stuff. But it is difficult because there are no masking mandates in the state. The CDC recommends masking in healthcare settings, and so does Indian Health Service, and rightfully so. We require all of the people that come into our clinical area to be masked, our employees, and also the people who need to be seen. So anybody who comes in has to wear a mask, and we remind people about the physical distancing also. So it's a very difficult tension. I'm going to add.
Yeah, I would add our situation, not just here in Alaska, but all over the world, really is changed now compared to where it was last November, when most cities and states were looking at lockdowns or hunker downs and the economic consequences of that. Right now, we have this is a vaccine preventable illness, and we have a tremendous tool that we didn't have this time last year, which is vaccines. They're they're just as safe. They have the identical safety trials and as all of the vaccines we give to kids before they go to school, or tetanus boosters. They're the same vaccines essentially, and they work. They work in the same way. In fact, in some ways, even better than our historic vaccines for preventing illness. So I'm personally very hopeful, and I think our leadership is in Alaska is very hopeful that with increasing vaccination rates, we'll see a win-win with the economy, and that jobs will be sustained, that families will have incomes, and there'll be food on tables. And so vaccination equals a healthy economy, essentially. That's why it's a public measure.
Yeah, and just to top it off, it would also decrease hospitalization rates and decrease death rates, decrease the number of people with complications from COVID. There's so many positives with the vaccination, and also decrease the risk of having another variant show up. So there's lots of reasons to get vaccinated. And it's just interesting that vaccination has become a political issue. It doesn't make sense to me that this is a public health issue in my mind.
Well, and perhaps if it had been framed as Dan just did, as a pro-business effort, right? You want to keep more businesses going. Let's get vaccinated so that we can come together and spend money at those businesses.
Right. We pool money to repair roads so that business can be sustained. Like commerce would not happen without road and rail. It wouldn't happen without the federal subsidies for air travel. It's water and sewer is a similar thing. We pipe water and sewers with tax money so that societies can grow and can be healthy. Public health measures support economies. That's why we do them.
Chief Williams mentioned that he said about 40% of I don't know if he was talking specifically about his community or of the general area of Bethel. He's not too far from there. Wasn't vaccinated and was having challenges engaging those folks. how do we have a conversation with people? I mean, I've got close family members, right, not vaccinated. One's contracted COVID, and my idea was, hey, let's have our grandfather ask her to be vaccinated. I don't know what else to do, right? How do we have conversations with folks to help them answer their own questions, right?
I think it's I think that's the question, but I think it's has many answers. So I think some people would listen to their elders. I think some people would listen to their healthcare providers. Some people are gonna, listen to the media. Some people are gonna do their research themselves and try to figure it out themselves. Some people just really do not want to hear anything but what they believe, and that's the most difficult to overcome. There's been so much false information out there about COVID and about the COVID vaccine, and even the treatments, that it is amazing what people are choosing to believe. And there's a ton of conspiracy theories out there too that I just, I don't know where they all came from, but there's a ton of them. And so it has to be almost a one-on-one conversation with somebody, and with somebody. Here, how we try to approach it is, we have the people we serve, we call them customer owners, in panel to a provider, and we want them to be in conversation with their panel, with their provider, to ask questions, because they are in relationship, they know each other, and trust each other. And so hopefully, they're open with their feelings, and the provider can actually give answers to the questions that they're asking, so that they can be better informed. That is a slow process because it's one-on-one, but that has been our focus. And then we're trying to tie in with what the state is doing and have our own campaign. Dan, do you have anything to add to that?
No. It's really just like anything, it's personal, it's relationship based in most cases, and everybody makes their decisions differently, and so there's a million answers to that one question. It's a long road.
Yeah, it is.
If I wanted the vaccine right now in Alaska, there's plenty of it? Can I come down to the clinic tomorrow, or what's the appointment? What's the process?
You can come today if you want.
You can get one within 10 minutes of walking up to the front desk.
So there's plenty of vaccine. That's not an issue.
No, it's not an issue at all.
And what are you anticipating around the vaccine being available for children ages 5 and up? We heard right in the last few days that the maker of the vaccine, the Pfizer vaccine, was saying that the data is very, very promising and positive with children. The federal FDA hasn't said so yet, but is expected to. What's going to happen, do you think, with rolling out the vaccine to children?
I think that it'll be like the rollout with the other vaccine. With the other population, that there's going to be some early adopters, because there's been a lot of parents who have asked me, when is the vaccine coming for my child? I want my child vaccinated right now. But I think there's also some parents who might be a little slower with their kids because it's their kids. And so they might not, even if they got vaccinated, they might not jump as quickly for their children to get vaccinated. And I think it's really important to focus on the studies and what the studies show, and that they've been very, very positive, and no adverse effects have been shown. So, that's what the focus should be. And, how can we protect our children too? Because as we're seeing with the increasing numbers of COVID, we're also seeing a lot more kids getting COVID and more being hospitalized. So they aren't immune. They do seem to weather it better than adults, but there's still lots of risks with children too.
Yeah. Dan, we're going to add anything?
I'm personally, and I think as medical professionals, all of us are very appreciative of the FDA's thoroughness in evaluating trial data for safety and effectiveness. So we're all looking forward to FDA review of 5 and up for the Pfizer vaccine, and then later for other vaccines like Moderna. And then in the coming year, we'll probably see 2 and up, and then even 6 months and up approved. So as the process evolves, we're behind it, of course. I love that it's a safe, careful process of review and not a rash or hurried process. We're taking, as a nation, as the world, the entire world is Canada, the United States, Asia, Europe, everybody is taking their time and evaluating the safety data to make sure that it's safe for all.
What a year ago, as you said, we didn't have a vaccine. There was a great fear of the unknown, right? And I think one of the fears of folks like yourselves was we didn't know to the extent how many people were going to get seriously ill, and to the extent they were going to need intensive treatment, right? And there was this concern about a lot of ventilators and a ventilator shortage, but basically the fact that the hospitals and clinics would be swamped. And that never quite happened, I don't think, to the extent in most places in the country that we thought. But now we're getting closer to that situation. And why should I care about that as someone who's healthy right now, right? How do we arm people with the right information about the fact that the emergency rooms are closed, and what does that mean for me, and if I need to go there?
Means that care can potentially be limited for you and not even have anything to do with COVID. I mean, if an individual is in a car wreck, or they have a heart attack, or if they fall off a ladder and break a leg and they need to go to the hospital, things are going to be slow. And they might not get in immediately unless it's in an emergency. Then they will eventually get in, but then there might not be a bed available.
Yeah, the call has gone out by our health leadership and political leadership in parts of Alaska, rural Alaska, that you really should avoid rolling your ATV or swamping your boat or falling from a height. Careful on your moose hunt. This is not a time to get hurt. This isn't a time to get pneumonia, for that matter, or to have a heart attack. Right now, in a lot of parts of our state, we're at that point. And capacity in our health system has its limits, and we're starting to find them, unfortunately.
We have seen times when people out in the rural areas need to come in for a higher level of care, and it's very difficult to find a bed. All of the hospitals have to work together and see if there is a bed available, and not just in Anchorage, but they pull in other hospitals within the state to see if there's a bed available where somebody can be sent. Sometimes, there's been times when we wanted to transfer people because we had too many inpatients. We had to transport people to another state even. And one instance where there were no beds in Washington State, there were no beds in Portland, and we actually had to transfer to Colorado. So it's not just Alaska, it's all over the place. And so you're looking at a system that is completely backed up from the rural to the cities to the major metropolis areas. They're all backed up, and it's a scary time in healthcare.
And you don't have enough workers to begin with, right? You said Alaska's importing pharmacists and other folks that are willing to hop on a plane and go for an adventure for a few weeks, right?
Yeah, there aren't enough employees. And the employees that we have are awesome. They're working so hard and such long hours, and everybody is pretty darn tired. I mean, we're 19 months into this, and then the last several months have been very, very draining for everyone.
And what is the feeling there? I mean, there's been a lot of talk about mental health, right? And as you said, maybe a sense of hopelessness sometimes, right? Among, I would imagine a lot of healthcare providers go to work every day. It's a new day, it's a fresh day, and you're there to help people, right? And you're there to not necessarily always save lives, but it's a prestigious profession, right? And it hasn't been treated that way, it doesn't seem, the last year plus. And to hear the stories that you're saying of not enough people to go around, probably some, right, some concern of treating folks that didn't want to get vaccinated and now they're coming in sick, and that kind of feels I don't know about depressing, but certainly negative, right? So what is the mental health and morale like in the South Central Foundation and in your clinics and hospitals and providers?
You want to go first? I can.
I can.
Okay, go ahead.
I think people are tired. Yeah, everybody is tired, super tired, and more tired than we were a year ago. Um, we're all coming to work. We're all the same people with the same motivations, and I think we're used to treat. It's an interesting question. How should we feel about treating folks that have made tough choices? Well, we treat people that have made tough choices their whole life with equanimity and honor and care. You know, they're humans just like everybody else, and we all have families. They have families. They care just as much. If somebody has made hard choices with substance use, for example, I'm not going to. Who am I to judge? And so we treat people as humanely as we can with the tools that we have and the energy level that we have. And I think the key is maintaining a level of energy and sleep and wellness with home and work-life balance. But we'll survive. This is not about us. This isn't about the healthcare system. I think this is about the community. And importantly, I'm going to underline this again: the economy. You know, if we want things to do well, we have to do things together sometimes, and vaccination is one of those things.
How do you all feel about mandates? I believe the hospital there, the ANMC, has had a mandate for its staff. I just saw a story out of San Francisco where I think the San Francisco airport was mandating vaccines for workers there. We've seen NFL professional football teams, right, come this close to mandates for their players because of what happens when the star quarterback, you know, the unvaccinated quarterback, is out for multiple games. They're going to lose and they're going to pay a price. What's the sense of mandates there?
I think the vast majority of our employees support a mandate. It's been well received. There are, of course, a handful of people who it is not well received with. And, you know, that it is their decision on whether they get vaccinated or not. But if they want to stay employed here, they have to get vaccinated. And I support that. But, you know, I am pro-vaccine, and I got vaccinated a while ago, just as soon as I could, because I understand the benefit of vaccines. And I also, you know, for personal reasons, got vaccinated because I want to protect, you know, elders, and I want to protect my grandchildren who can't get vaccinated, and then elders just because a little higher risk. So, you know, vaccines work, and that's, you know, I just have to underline that they really, really work, and you know, there's been a lot of studies and research. There's still going to be more studies and more research that comes out from all different aspects of COVID, including the vaccine, but they do work and they are safe.
Well, thank you, Donna Galbraith and Dan Hartman from South Central Foundation. If you have time to stay with us, please do, but I don't want to keep you there in your situation room if you've got people to take care of, because I know, as you said, it's a busy time. I wanted to bring in the conversation, though. You might say hi to him before you drop off. Gary Ferguson. It's Old Home Week, Gary. I bet you know these two.
Hello.
Hi, Gary.
Good afternoon.
Gary, you were working in Anchorage for a long time at AT. I get these acronyms, ATNHC, and then you boogied down to Seattle. And how long have you been down here in the lower 48?
Yeah, so I was 10 years at the Alaskan Native Tribal Health Consortium, working as the Director of Community Health Services, and prior to that, Wellness and Prevention Director. So a career at ANTHC. Love the tribal health system and the amazing work that we provide for our patients and our families and communities. And I accepted a position here at Washington State University as Director of Outreach and Engagement Faculty here at the Elson Floyd College of Medicine at WSU. And we do a lot of work on research in our Alaska Native and American Indian, Native Hawaiian, and Pacific Islander communities on health equity and vaccinations. Morbidity and mortality related to disease is the top of our agenda. So this topic is definitely near and dear. And also we've had multiple listening sessions and focus groups on perceptions of the vaccines, and also, how communities are responding to the pandemic. And, it's really, of course, sobering to see the number of lives lost. Just saw the news report saying that, we've lost more people than the 1918 pandemic already from COVID. And so it's very sobering. And at the same time, as we look at how communities have become so resilient and have dealt with it and had used self-determination, especially many of our Alaska Native communities, how they've responded has been really noteworthy and inspiring to see how communities have come forward to protect their elders and those more vulnerable. And I feel like that's kind of the silver lining that we have right now is people are showing up and more information is getting out around our vaccinations. As our South Central colleagues shared, there is a priority by tribal health system, especially as an employee, that you be vaccinated, as well as we're modeling the way to health and well-being as leaders, right? We walk the talk, and I think that's really important that we get vaccinated, that we wear our masks in public arenas, and we practice these public health measures that we know work.
You are, I've never said this word before out loud, Gary, but you are Unaga.
Yeah, Unaga.
Unaga.
I'm an enrolled member of the Kagan-Taigungan tribe in my hometown of Sandpoint out in the Aleutian region.
Describe the Aleutian Islands to us. I mean, we've heard about them. We think we've heard a little bit of World War II, right? Many of your people, right, were relocated because of the war and dislodged from homelands, and is a terrible, terrible story that the history books haven't told many of us, that moved down to the southeast part of the state and even down probably into other islands south of there, but it's not where the Aleutians were. And what's it like being from a fairly isolated place, right? Just a plane in or a boat ride in?
Yeah, exactly. And, it's one of the places on the planet we're known as the birthplace of the winds. And so those of us who are from there, as well as who have visited there, know how vigorous the winds can blow. It's in the other parts of the country, we'd be calling it a hurricane, whereas just another day in the Aleutians. So we have an amazing ring of fire with our active volcanoes, and the community that I am from is really close to Pavlov volcano, just 40 to 50 miles away. So, we're used to a vigorous life and a vigorous landscape, and it's an amazing area where you can get on a plane. Like right now, if you were to get on a plane and fly out to some of our further communities out to Adak or to Atka, you're going to spend 2.5 to 3 hours to Dutch Harbor on Alaska, and then you're going to go another 1.5 to 2 hours out further. So we're 1,200 miles or more to some of our further flung communities. And of course, the Pribilof Islands also are a part of our region. And, it's at least a 2.5 to 3 hour, if not more, flight out. So it really gives you a sense of how large an area, and also from a health perspective, the challenges of providing healthcare services, and especially if it's emergent care. And that's where, as we talk about COVID-19 and the pandemic, the importance of prevention, because if you were to get really sick, you're a medevac away, and it's a long ride. So we're not talking about the golden hour anymore. We're talking about hours and hours, and sometimes even days if the weather's inclement. So, the responsibility of communities to take the pandemic seriously and to follow public health guidelines is crucial. And to me, that's been the journey that many of our communities have faced. Cold Bay, which is where I have a lot of family right now, and we have some family businesses, was known as quote unquote affectionately COVID Bay. We had half the town come down with COVID early on in the pandemic, the first community to really be impacted. And part of it is because it's a hub. So we have a lot of traffic in and out, lots of flights, lots of people from all over the world going out for the canneries and the fisheries. And that's what Aleutians are known for, the deadliest catch, the crab fishery, our salmon fishery. So one of the bright spots that is very exciting from a company perspective is Peter Pan Seafoods, which was recently purchased from a Japanese owner to American owners. And they have stepped forward as a seafood company that requires vaccinations for their employees. That was as of September 1, I believe. So, companies are stepping forward to protect community members and residents. And to me, that's very comforting, especially for our elders and more vulnerable in the region.
Yeah, you would think that. I mean, I remember the early stories, Gary, and thank you for painting a lovely picture of your homelands. When it all clears up, you're going to host a group of us. We're just going to come check it out in person. But remember some of those early stories, say in South Dakota, right? Some of those meatpacking plants that had these outbreaks. And wouldn't that have been a great opportunity for political leaders to say, hey, we're going to get these workers the vaccine the minute we can. Until we can, we're going to keep people separated and try to do this work differently. It didn't happen. At least it didn't happen a year ago.
Yeah. And I think we've learned a lot in the last year of what works. I mean, early on in the pandemic, people were even questioning masks, a cloth mask. Does it really slow down the transmission of the virus? And now with actual research shows that you wear a mask, it reduces transmission of the virus. And I'm now in Seattle, and I'm back and forth. I'm going to be back up again next week, so I'm back and forth to Alaska right now. But we have the Mariners games, we have the Seahawks games. They're requiring vaccination, and they're also requiring a negative COVID test if you don't have a vaccination, and also wearing masks. So I feel like our larger urban centers, in Alaska and other communities, as we look at, taking things seriously and really protecting, especially with the more virulent Delta variant of COVID-19, that we have to stay vigilant. And many of us are getting COVID fatigue, right? We're pandemic fatigue. And so we're done with the mask. We're done with, the fear. And, we want to return to business as usual, but I feel like the new normal for the next while is going to be masking. And when I think of our Indigenous values, I do a lot of work in our Native community. And, if you look at our values, who are we as people? We're all about respect. We're about respect for elders, for children, for caring for each other, for caring for the community over the individual. And I feel like if we're going to live by our values, we're going to get vaccinated. We're going to wear a mask, and we're going to care for each other in a way that's respectful. And to me, that's, being proud of our Indigenous heritage and our ancestors and the values that they shared with us that are really important. And, communities who have taken it seriously by wearing your mask, getting vaccinated, getting regular testing of COVID, that really greatly reduces folks who are more vulnerable from getting the virus.
Mm. You've talked to a lot of people, focus groups, and other research about the vaccines. Besides trying to appeal to folks' sense of respect and sense of caring for the vulnerable and the elders and so forth in our family, I mean, yes, those are powerful feelings, right? That help us make decisions. Is there other information that we all should be familiar with that you think would be more effective? What advice do you have for us when I'm engaging my family members that still aren't vaccinated and don't want to come across as a know-it-all or telling them what to do, but what do I need to know?
So some of the thought streams that came up during the focus groups are, number one, the historical mistrust of healthcare workers, some of the early experiments that were done without permission, research that was done without permission in our Indigenous communities. So I feel like there's a historical overlay of mistrust. And so when some of the first information that came out about the pandemic and the COVID-19 variant and variants that have been forthcoming, I feel like folks didn't necessarily want to follow the scripting because they didn't trust. It's like with the vaccine, it came too quickly. And of course, the politicizing of the vaccine, those came up as very strong messages that folks were like, we don't trust it. And at the same time, having factual information, having it come from tribal leaders, from folks who have the political leverage in their community, so that you have factual information, science-based information that really helped folks. And we had some of our focus groups started out with, we did polls where folks were asked if they had gotten the vaccine, were planning to get the vaccine, had family members that got the vaccine, or if once it opened up for younger adults or children, would they get their children vaccinated? And there were some focus groups where there were a lot of folks that said, we're not going to get vaccinated. We don't plan on it. We don't trust it. And after the focus group was over, and after people heard stories of those that were affected by the virus, those that were experiencing long haul COVID, or the symptoms that are after you've been infected, loss of taste and smell, headaches, or other kinds of physical complaints related to the virus, it really started to change people's minds. And also folks felt comforted being able to talk about it. And I feel like that's the most important, is let's have conversations that matter. Like today's radio show, let's talk about it. Let's talk about how it's affecting our families. Let's grieve with the families who have lost loved ones to COVID, because it's impacted our families. It's impacted my family. It's impacted my community deeply. We've lost elders. We've lost loved ones to COVID. And having a forum to talk about those stories are poignant. And I feel like it helps to steel us in what can we do to help prevent this? How can we show up for our community? And also, how can we talk about what our fears are? And also, those, for example, those who grew up with a mistrust of law enforcement in their communities, when law enforcement shows up, you don't know whether or not you're going to trust them or not. And I feel like, having accountability, and also, deep conversations with healthcare leaders and tribal leaders, if you're coming from a tribal community, how can we talk about this in a way that it's not about shaming you for not getting the vaccine? It's about talking about, what are the consequences? And in our health systems in Alaska right now, they're at capacity, and some of them are over capacity with COVID patients that are seriously ill. So right now, it means if you were to have an accident, or if you were to need emergent care, you might not get the best care because the ICUs are full. And I feel like, to me, that, again, the onus is back on us in the conversation of, let's talk about our fears. Let's talk about what's holding us back. And let's also talk about others who have made it through that. Maybe they chose to get the vaccine after being reticent to get it to start with. And I feel like, what a lot of folks reported was just having a conversation where they were able to get it out and talk about the reasons why they weren't going to get it, help them make a decision and move further along the way towards actually getting it for them and their families after the conversation, and also after factual scientific information was shared.
As a naturopath, the first time I met you, you were doing a session on healthy cooking and traditional plants and the store outside your door, your work up in Anchorage. And that's so the foundation and the wellness of Native people too, right? Is very place-based, and the medicines that we grew up with. How do we? I get the sense that this is an opportunity to even go back to that kind of thinking and living too, right? If we're about prevention and we're about the long haul, this isn't going away anytime soon.
Exactly. And, as a naturopathic physician, our training is all about prevention and wellness. And, what can we do from a nutrition perspective to be as healthy as possible so that if we were to get sick, like for those of us who've been vaccinated, there are breakthrough infections. So, you may still get COVID. And the nice part is we're seeing that folks who have the vaccine that get a breakthrough case are less likely to be hospitalized and less likely to die. You still get sick though. And so, your health status going into an infection or viral infection is really important. So your vitamin, eating vitamin D rich foods or taking a supplement or, making sure you get some sunshine for those of us who have the luxury of getting out in the sun or taking a sun trip. Um, our traditional foods, we know our traditional foods are medicine for us. And not only that, but they connect us to our ancestors and our culture as well, right? So, our healthy fats that are in salmon and seal and whale, and our game, or right now people are moose hunting. So we got fresh moose and caribou. Those are nutrient dense, and the more nutritionally replete that you are when you get sick, the better that you deal with the sickness. And so nutrition really important, both as a prevention as well as when you're sick, right? So, moose bone soup, or fish head soup when you're sick, those are incredibly nutrient dense foods that you can eat even if you're not feeling so well. And also colleagues and others who are trained in our botanical medicines and indigenous healing techniques have created some really great guides. Seattle Indian Health Board and other partners, including Indian Health Service, contributed to a compendium of some of our botanicals that are good for upper respiratory health. And that's online and for a free download. And I'm happy to share the link for both prevention as well as for when people get sick. There's not a lot of research yet on botanicals and COVID-19. So, we can't say it prevents COVID-19 or treats COVID-19, but we know that it's effective against influenza and other viruses, some of these botanicals. And, of course, across Indian country and our great nation, we have amazing plants that have been used for thousands of years for whatever virus or ailment that comes into our community. And that wisdom is still as powerful today as it was thousands of years ago. And one of the projects we're working on with Washington State University, our School of Medicine, is training our future physicians and nurses and healthcare workers in an understanding of our indigenous ways of knowing and healing so that, we embrace them and use them, because these are incredible, powerful techniques and medicines that now have been made into blockbuster drugs and other therapies that have indigenous roots. And so we have a powerful pharmacopoeia that we can draw upon from our landscape. And that movement is growing in Alaska, which is really exciting. So I feel like we're armed with tools, but prevention is the best medicine, right? So, what can we do to prevent from getting sick? And that includes vaccination, wearing your mask, staying nutritionally sound, getting your rest, having healthier stress coping. Right now, COVID has made us more lonely than usual. Many of us are isolated, and substance abuse and other kinds of negative coping are on the rise. So, looking in the mirror and saying that today's a day to make better choices, to reach out for help. Or if I'm suffering from a mental or emotional, spiritual sickness, that I ask for help, because now is a time to be in community, and even picking up the phone and being old school and talking on the phone to somebody really helps during this time, because we're isolated, and especially many rural communities, people are really isolated.
And turn off the TV sometimes and turn off the news, because the headlines are not promoting a conversation, right? They're just showing us the latest, who's got the latest punch in or the latest wound in to win some whatever the game is supposed to be here.
Exactly.
If you go to the comments, Dr. Gary, the comments chat, and type in that link or paste that link, I thought we'd love to see the reference that you were talking about with the moose bone soup recipe. I think you promised us there.
Yeah, got it. You got it. I'll send you a couple links. You got it. And in the end, the key is to not live in fear, but to be proactive. Take care of yourself, get outside, have fresh air, eat good, talk about what's causing you to be stressed. And insomnia, there's a bunch of different challenges that folks are facing right now. And so, asking for help, reaching out to your network, talking to your provider. The virtual visits, telemedicine is a standard of care right now. And so you don't need to go into the clinic if you're afraid of getting exposed. You can call in and have a televisit. So there's a lot of resources available to us right now, including, our ancestors always said in the region I come from in the Aleutians, one of my elders, Nora Newman, when she was alive, shared all the time. She goes, "When the tide is low, the table is set." The beach is like there's food and it's good food for you. It's medicinal. Our food is our medicine, and that still resonates. We got a lot of resources in many of our communities, especially Alaska, where we're blessed with a food system that is vital, and that food system and those healing foods protect you, help you do better should you get sick.
Dr. Gary, before you leave, and we bring in Ayu Kasatak from the First Alaskans Institute. I know you have a young one at home to keep you on your toes. Ayu has several children, a little older than yours, but also in this new 5 and up, the Pfizer vaccine coming soon, we hope. What's your thoughts on vaccine and children, Gary, particularly as a naturopath?
Vaccines are a great way to help the body heal itself. It works with the natural healing ability of your body, which your body can heal itself when given the proper support. And so vaccines are a way to help the body heal itself and recognize and be emboldened against viruses, right? So we know for polio, some of these other childhood illnesses have been cured because of vaccines and modern science and our techniques in medicine and healthcare. So I feel like right now, I mean, our child has had George Martin has had his vaccines up until now, and should a vaccine be approved for his age group, we'll be first in line to get it, because it's one where the disease itself can cause very long-term illness, and vaccines, some of them do have the potential to cause side effects. We know that, but the benefits greatly outweigh the risks. And so we're excited to see the vaccines be brought out to our younger population, and we'll be the first in line.
Well, it's always fun to see you and that cute, what is he, 1.5?
Yeah, he's going to be 2 in October. So yeah, he's growing fast.
Does he have an agent?
He's definitely a popular, and we're so thankful for our loving community that support us and root on George Martin. So he's one of our famous Alaskan Native kids.
Yeah, he's a cutie, and there's many posters waiting for him to make them even cuter, because he's a beautiful one. Gary Ferguson, thank you for joining us from Washington State University in Seattle, and thank you for posting the moose bone soup recipe in the comments. And take care of yourself. And let me welcome Ayu Kasatak from the First Alaskans Institute. And Ayu is from Unakleet. You guys talk way down here, so you'll have to give us the pronouncer for a lot of the place names in your homelands. Welcome.
Thanks. Man, you guys were making me hungry. It's lunchtime here in Alaska. Ayu Rurunga, Ungalaklek Milrunga. I'm Ayu Kasatak. I come from Ungalaklek, is the original name of Unakleet, is one of the ways that we pronounce it. There's lots. I currently live and raise my children on Dena'ina lands in Dagayakak, also known as Anchorage, along with our earlier guests. Kliyamakbak for having me.
Well, thank you for joining us. That alone right there was worth it. You can sign off now and go home if you need to.
Bye.
You said it snowed there today?
Yeah, a little bit. In some parts of town, it was dusting, but it's pretty melted already. It's really blustery, but sunny.
One of my visions of Anchorage in the wintertime is downtown, and there's walls, and in most places, well, you all have graffiti, which is, it's America. It's 2021. Everyone's got some graffiti. But in Anchorage, they also have graffiti written in the frost.
Mm.
That's some serious graffiti.
Yep, absolutely.
What's the state of the coronavirus in your community, in your household? You've got young kids in school. Young man just graduated from high school and college. How's COVID-19 treating you?
Oh, goodness. Like so many others, it's been just quite a roller coaster, right? I've got 4 kids. My oldest just graduated high school. He started college. As a mama, I'm very thankful that he was able to get his classes transferred into an online format. But also as a mama, I'm sad that this is the beginning of his college experience is on Zoom. As it was graduating high school, virtually was not the greatest experience. And then, we've got younger ones. One of my sons is attending high school in person, but they're using really strict protocols around masking, social distancing, and those kinds of things. Our 2 youngest children are in elementary school, and we've made the decision to have them do their schooling virtually through the school district, which, is not super fun. I don't think for any of us, it's a pretty poor substitute for learning in person. However, we have severely immunocompromised family members. My parents are quite elderly and have, their own health battles, and it's just not worth the risk at this point. So you were asking Gary about vaccines for our 5 to 12-year-olds, and absolutely, we'll be right in line behind George Martin, for our littles. In fact, we were just talking about that. So super excited for that to come out for the kids.
Well, and it sounds like maybe even by Halloween, if we're lucky.
Mm-hmm.
What's the state of the coronavirus back in Inupiaq territory to the north? It seems that the vaccination rates in many of the regions up there are pretty high.
Yeah. So in my home community, we are hovering, I want to say, right around the 70% vaccinated rate, which is really good. My region, the Bering Straits region, and kind of around Norton Sound area, is between 65 and I think 68% roundabouts. In my home community, Ungalaklik, there's 1 active case of COVID right now, which is down, thank goodness, because 2 weeks ago it had spiked. You were talking earlier with Dr. Galbraith and Dr. Hartman about kind of weighing the balance of economy and health of communities. And, in our home community, it was out of town hunters who actually brought in COVID to the community. So that was really scary, but I'm really proud of our communities, I would say across the state, but speaking more personally of my own community in Ungalaklik, they even got an award from the Alaskan Municipal League for distinguished municipal leadership for their response to the pandemic, both for protecting the health and well-being of the community, as well as keeping an eye out for the well-being of the economy as well. Early on in my community, they formed what they call a tri-council with the tribe, Native Village of Unlakleet, the city of Unlakleet, and the Unlakleet Native Corporation, where the leadership of these 3, primary leadership organizations within our community came together to have conversations about what the response needed to be in order to protect the community. And they've done a really tremendous job of protecting our people, which I've been really thankful of. Here in Anchorage, it's, I would say, been more of a mixed bag. We currently have, so Anchorage, for those who don't know, it's situated on Dena'ina lands in South Central Alaska. And, we affectionately call Anchorage Alaska's biggest village because we've got Native people from across the state here that, now call this home. But more recently here in Anchorage, we have a mayor who is pretty vocal about being anti-mask mandates, has been encouraging people to look into the vaccine, but will not encourage people to get the vaccine. Just kind of running into a lot of, I think it was described earlier as just really politically charged around the decisions that we make in this pandemic time. So that's been quite interesting to be living in this community at this time.
I remember in the winter hearing about your village, your home village, of having the Iditarod stop outside of the village, so no one was coming in. Around most of the people, they all had to camp a couple miles out. That's serious.
Yeah. Well, that's something. So Chief Mike was on earlier. I'm just so incredibly thankful for the strong leadership of our Native people throughout this pandemic. I mean, from the very beginning, it was our tribal leaders who really came together to make difficult decisions in order to protect our communities. And they did it right at the very beginning, far before, our cities and our state and federal leadership were taking any kind of precautions in order to protect our communities. And so I really applaud our Native leaderships and including those within our tribal health system. The reason that Alaska was so highly vaccinated at such a quick rate was because of our tribal health system. And I know that's the case in other places across the United States. So it really has been our people showing the way to be.
And I remember you being, I mentioned earlier, right at the beginning, it was going so well for the corporations and the tribes, at least in terms of the vaccine rollout, right, that there was some media. There was at least one media story that suggested rather strongly that the Alaska Natives weren't helping. Why aren't they pitching in and help, bailing out our frontline school teachers or what have you? And Donna and Dan pointed out that eventually that's exactly what did happen. But at the time, it was sort of this, us them thing.
If I may say a little bit about that. I think that situation visibilized a lack of knowledge generally throughout Alaska, but I would say even throughout the United States about where our right to our healthcare system comes from, and a lack of understanding about what our responsibility is to enact our own healthcare. And I would love to hear more from doctors Donna and Dan if they wanted to speak to that as well. But that article was problematic on multiple fronts, but also because it was trying to call into question the ethics of the decisions that were being made for the vaccine rollout, when the reality is that our tribal health system is under no obligation to provide healthcare services beyond our Alaska Native families. And so the fact that we have done that, I think, just shows how our peoples and throughout our systems do understand that our responsibility to our community is collective. And so by taking care of non-Native family members, as well as non-Native community members, it makes the overall community safer for all of us. So I see our friends from the tribal health system here. I'd love to hear more from them.
When they were saying earlier, Donna and Dan, right, Alaska is so small, like many parts of the United States, right, that everybody pretty much knows everybody. And geez, why can't you just let the health providers and the experts get in the room and figure out what we should do, which is sort of what happened in, more discrete, distinct Native communities, but very complicated system that you all have to deal with there, even within South Central, right, with all these different stakeholders that you have. You all are muted, Dan. There you go.
Can you hear us okay?
Yes.
Great. I was just going to jump in because I was actually a member of I was one of 25 physicians that was on the vaccine allocation committee developed by the state of Alaska to look at the rank order or priority rank order for vaccine allocation for all persons in the state. And there was a wonderful effort on the part of the state to hear the voices of tribal health organizations. And that conversation did happen in a very structured way, sort of behind the scenes before the rollout. And Donna and myself and a number of other folks were very much involved in the allocation decisions for our tribal health organization in terms of who we were going to offer vaccine for to who first. Wrapping all that information up, I can just say I can speak with confidence that the decisions that were made were moral, ethical, appropriate. IU's input is spot on. I know, like, the people that are making comments to the contrary just are unknowing, essentially, and don't understand the fiduciary responsibility that tribal health organizations have for their communities.
Yeah, I would agree with that. But even, we have this obligation to provide care to American Indian and Alaska Native people, but we also believe in community, and we support our community in whatever ways we can and however much we can. But our first obligation is to American Indian and Alaska Native. And of course, when we first got vaccine, it was limited quantities at first. And so we wanted people who were most vulnerable to get the vaccine at first. So we started with 75 and above, then we went 65 and above, and then 50 and above. And then at that point, we actually waited a little bit when we got to 50 and above to see where we are at with vaccine in terms of quantities and in terms of people coming in and getting vaccinated. And at that point, we opened it up because there was lots of people coming to us, and we actually had a lot of different groups come in and get vaccinated, even though they didn't get their care here in our system. But then we eventually just opened it up to the entire public. Anybody that wanted to come here could come and get a vaccine. And it's just how we operate. We deliver care to our people, but we also recognize that we are part of a community.
Exactly. And I mean, the whole idea of this campaign, and there's one thing to, sort of want to market the concept that, we're all in this together, but in small communities where everybody really relies on each other to stay alive sometimes and to be well, right? You have to keep the circle strong, right? It's part of how people live and take care of each other. And that's the values, I think, that all of you have been talking about. Keeping the circle strong isn't about tribe, isn't about race, isn't about ethnicity, isn't about religion. It's about everybody, right? And now we have the vaccines to do that. And as you pointed out, and Gary and all of you, the tribal leaders were ahead of the curve on that, right? And treating this with the seriousness that we knew it required from the beginning.
Yeah, I agree fully. Our tribal leaders are incredible, and they recognize the need to get vaccine out to as many people as quickly as possible, and to keep the circle strong. I mean, that I love that phrase because it's reality, and it's how we think, it's how we live our lives, it's what we believe.
And part of the circle, right, is a big part of the circle is understanding and really getting to know each other. And as like you talked about earlier, taking time to engage with people that think differently and have different opinions. And I know First Alaskans Institute, IU, has done a lot of that work about having courageous conversations or difficult conversations or whatever you want to call them around race, around history, around some truth telling, if you will, about the fact that Gary's relatives were picked up and moved out of their homelands in the Aleutian Islands by the federal government and sent off to live in some foreign land, right? Which has happened again and again and again. And that's just one part of the story that's not told. But how do we have these conversations in a way where people don't feel guilty, they don't feel shamed, they want to come and learn? What's First Alaskan's approach on that?
Yeah, that's a great question. I think part of what we're up against is not having a shared understanding of the true history. Like you were just mentioning, our Anungah relatives, most Alaskans, let alone American citizens, know about that really dark chapter of our country's history. And here in Alaska, there are a lot of those dark chapters that are associated with the United States government and its relations with Alaska Native people. And those dark chapters continue to manifest today in intergenerational traumas and things that show up within our communities. And so we're not operating with the same understanding of how our history manifests today. And that's part of the missing link that helps us to understand why things are the way that they are. So, I was looking at the statistics recently for COVID that show that here in Alaska, like something like 31% of the deaths have been Alaska Native and American Indian peoples here, when we only represent 22% of the state population currently. And that just makes visible something that we've always known, and that is that, the risks and the ultimate prices that are associated with COVID are not equally shared. And so your question of, how do you bring people to the table to have some of these conversations? Part of it is breaking down that history so that we can understand the context that we've all inherited, and how taking an approach of equality, right, where we're treating everyone exactly the same when we aren't starting at the same starting line because of this history, actually exasperates the problem. It just makes the problem persist without understanding why, when what we need is an equity approach where we understand where these challenges come from and address those and work to make things right. So that's where a lot of our efforts have been um, throughout this pandemic, but I would say generally throughout our pretty short history. We just passed our 20-year anniversary, so we're still a fairly young organization. But that's part of the work that we get to do. And we've done it with a lot of really amazing partners, including South Central Foundation and others.
Well, thank you. Ayu, do you have any final thoughts as we close out this discussion? I really appreciate your time and your perspective as someone who gets to the rural areas quite a bit from your base there in Anchorage. What are your thoughts on how do we keep going? Because this is not going to. We know it's going to go. We're going to have another tough winter, however it ends up being. Right? How do you keep strong? How do we keep focused on what's important?
Yeah, I love that question. Early on in the pandemic, there were a lot of things that First Alaskans did to try and mitigate the sort of suddenly being shoved into isolation. I saw some comments that were talking about how painful the forced isolation was, and I would say in particular for Native people, it brought up for many of our people some triggered some painful memories around being separated from family through the boarding schools and other pandemics, right? All Alaska Native people today are survivors. Excuse me, all Alaska Native people today are descendants of the survivors of the last pandemic. My namesake, Ayu, my grandma's mom, was orphaned by the last pandemic. And so we understand on a visceral level, quite intimately, what it means to be part of an ecosystem where we have responsibility to each other. And early on in the pandemic, we had instituted with our staff, when we all moved to working remotely, which we still are, as a way that we can continue to be responsible to our community, is mitigating that risk. We instituted our phone calls with elders. And so we, invested time, staff time, for our staff to reach out to and call and just spend time on the phone with elders throughout the state, just to have some of that connection and help us to know more about what's happening in our communities and how we can be responsive to our people and whatnot. And, I got to spend time with an Inupiaq elder that I just treasure, Daruk. And one of the things he said in the very beginning, when we were talking about how hard it was that we were suddenly isolated from people that we love, and he said, you have to remember that the time that we're sacrificing now away from our family and from our community is going to protect our family and our community for generations. There will be no future generations if we're not here. So sacrificing now is going to protect our future ancestors. And that has been such a beautiful touchstone for me throughout this entire pandemic. And to remember that, as painful as it has been, it still is temporary, and just trying to move forward in a good way and responsibility as a good relative to other community members has been where we've tried to center ourselves in our response.
Thank you for that wisdom. That was like, oh. Donna and Dan, any final thoughts before we say goodbye?
I've really enjoyed this show, and it's felt more like a conversation, and I've appreciated everything that people have said. It's been very good, so thank you.
Yeah, thank you, David, for organizing this, and thank you for your wisdom there.
Well, Doctors Dan and Donna, thank you for your extremely heroic work. Even just your paper pushing, right? That's we know thankless, and nothing works without it. So we really, really appreciate your valuable time. Ayu, thank you for the story of your grandmother and reminding us about how temporary everything is, right? The Spanish flu was just a couple years ago, and here we are in another difficult time that we will get through together if we keep the circle strong. So thank you so much for your time. Stay warm and well in Alaska. This has been a Facebook Live discussion, a town hall, if you will, on the state of the coronavirus, specifically with our friends and relatives in Alaska. And thank you for joining us, everybody. Be well. Bye-bye.